Hi everybody, Leslie here with Pink Pepper Co. Wanted to do just a quick overview of a JP drain. Anytime you have a breast surgery like a mastectomy, they usually install some sort of drain, 2 or 3 on each side, maybe 1 on each side. I was really nervous about the drain when I had my mastectomy because I didn't know anything about it. There's nothing to be afraid of. So if I had known more, I wouldn't have been so nervous. So I thought I'll just go over this real briefly with you so you can get an idea of what it's like and what you're going to be working with after your surgery. Of course, a doctor and a nurse is going to go over this with you. They're going to give you all the information you need. So this is just an overview of what it's like, just so you get a little bit used to it. Okay, so here's the drain. This tube is actually going to be inserted somewhere around your torso area, and then it's going to slowly fill. So what it'll look like, basically, it'll be deflated like this, and as it starts to fill, it'll start to get bigger like this. And they're going to want you to drain it. That's why there's this little opening here. They're going to want you to pour it out and keep track of the fluid that's in it, and you're going to probably keep track of that on a piece of paper for them and call in. Again, they'll give you all those instructions. One thing they probably will ask you to do is strip the line, and that basically means you're going to clamp it off with your fingers, the tubing here. It'll again be attached somewhere here, and then you're going to pull it like this real tight, and you're pushing all the fluid into the bulb end. You're going to do that usually before you drain it. Then you're going to open it and drain it. One of the really important things about draining your tube is you're going to use these alcohol swabs. After you drain it, you're going to clean this whole area really, really well all the way around, and then I used the alcohol swab to seal it back up. One of the other things you do after you drain it is you're going to crimp the line so that no air gets back. You're going to squeeze it really good so it's completely flat, and then you're going to close it like that so that it gets that suction, so that you always have the flow going this way. One of the other things that's a little difficult with the drain is when you shower. Some doctors will say you can't shower. If you can shower with the drain, one of the things I used was just this little ribbon, just like this, and all the drains have some sort of little attachment here. You can just pin it, and then you can pin it to this so that in the shower it's not flowing all around. You want to keep it in control here. And also, you can't just leave these hanging. It's just one little stitch that's attached to it, so you have to always have it somehow contained. So for the shower, this ribbon is great. When you're just around the house or when you're sleeping, this shirt is also really great. This is our mastectomy t-shirt. It buttons down the front so that you can get it on and off very easily with snaps. And then on the inside here, there's pockets to fit the drain in so that you can just slip your drains in here, whether you're, like I said, whether you're sleeping. It just kind of keeps it contained. Then it's not hanging. You don't have to worry about it. It's not hanging around your neck. And then you have a comfortable shirt that you can sleep in. You can go to the doctor in. It's really handy. This really helped me a lot during my surgery. So thanks so much for watching this video. Please watch our other videos about more of this kind of information that you might want to prepare and some things you might need to do after your surgery as well. Have a great day. Thanks.